Private medical practices are turning to the government for help to weather the financial impact of COVID-19. Private practitioners say virus fears have kept people away and led to a sharp drop-off in revenue.
An association of private practitioners is seeking a tax break for clinics, as well as a raise to the doctor's consultation fee. Physicians are also seeking a bigger ration of N95 face masks to protect themselves against infection.
The waiting room is far from full. As the epidemic widens, people are choosing to stay away from medical facilities. It's left private practices struggling to survive.
5万会员保守估计至少1年。
Based on conservative estimates, COVID-19 will last at least 1 year because there is no vaccine yet. Since there is no vaccine, many people will continue getting infected. The epidemic will absolutely not be contained in the short term. The average medical clinic has fixed monthly expenditures of at least 300,000 NT. This epidemic could lead to the shutdown of a wave of newer clinics.
The doctor says business is abysmal and small clinics are suffering. The Taiwan Medical Clinics Association is calling on the government to raise doctors' consultation fees by 18% and to cut taxes for small clinics by 8%.
全世界像台湾这么低的诊查费的。
It seems no other place in the world has consultation fees as low as Taiwan's. A fair way to decide those fees would be to adjust it with the consumer price index. Costs for clinics and hospitals keep increasing. You can see how staff costs have climbed. They put an extra person at the entrance to screen people with fevers. During this period of crisis, we should be included in the government's bailout package.
Clinics say they need higher consultation fees and tax breaks, as well as protective supplies like N95 face masks. Since the start of the year, this clinic has been allocated only 4. The masks are so precious that they are stored in plastic bags to be worn only when absolutely necessary.
假设我真的要防疫弹。
Suppose I wanted to be extra cautious and wear an N95 for every session. Even if I reuse the 4 masks several times, how long would they last me? There's nothing that healthcare workers at private practices can do. We're all just using basic surgical masks.
The 2003 SARS epidemic also hit small clinics hard, but the worst lasted only 2 to 3 months. Private practitioners say they worry about the many uncertainties of COVID-19. In response, the Ministry of Health and Welfare is drafting a budget to help private practices weather the outbreak.